So good afternoon or good morning for some of you, and welcome to the Administration on Aging Intrastate Funding Formula Training, which I believe may be the first, or at least it's one of the first in my 10-year tenure at the Administration for Community Living. We hope this training will be helpful resources for states and territories reviewing their current intrastate funding formulas and or looking at changes in the future. I am Alice Kelsey, Aging Fiscal Policy Specialist for the Administration on Aging and the Administration for Community Living, and I'm currently joined today with my colleague Rhonda Schwartz, ACL Regional Administrator for Region 2 and Acting ACL Regional Administrator for Region 3. Rhonda and I would also like to thank Nicole Becerra, Aging Services Program Specialist here at ACL, who is acting as our moderator on today's webinar. This training, as I mentioned earlier, is being recorded. If you do not agree to being recorded, you can hang up or disconnect at this time. So now I will hand the presentation over to Rhonda Schwartz to kick us off today.
Thank you so much, Alice, and it's a pleasure to be with all of you today, and thank you, Nicole, as well. As you all saw, you received the new state plan guidance, which contained information about the intrastate funding formula. Now, the intrastate funding formula is an important component of a state's plan to implement its Older Americans Act programs. And the purpose of our training today is to review the guidance that we provided regarding the IFF as it applies to state plans. So here's a quick summary of what we're going to cover today. We'll talk about due dates. We'll touch upon the interstate funding distribution, which covers how the federal government allocates the Older Americans Act funding among the states. And then we'll spend most of our time on the intrastate funding formula. We'll look at what Older Americans Act funds are subject to the IFF. We'll look at Older Americans Act requirements relating to the IFF. We'll look at both the required and optional elements of IFF. We'll also take a look at the process requirements if you're going to update or modify your IFF. We also will look at single TSA requirements. Those are single planning and service area states. While they don't have IFFs, there are some requirements that apply to them. And we also will go over at the end of the training the next guidance, state plan guidance training that will be taking place. Next slide. So quickly, in these next few slides, we're just going to run through the due dates for various states from 2022 through 2025. So this first slide shows those states that have plans due July 1st of 2022. Take a second to let folks look at that slide. Then we'll go on to the next slide. This is a much larger group. We have state plans due July 1, 2023. Those states and territories are listed on this slide. And then if we can go to the next slide, this smaller group has state plans due July 1st of 2024. And then finally, the next slide, these are the states that have plans due July 1st of 2025. I think we'll go to the next slide, and I will turn things over to Alice.
Great, thanks, Rhonda. So I thought it would be good to start us off with first how ACL distributes funds down to the states, which is called the Interstate funding formula. So the Older Americans Act statutorily prescribes how funds are allocated to the states. For Title III, Part B, Supportive Services, Part C1, the Congregate Meal Program, Part C2, Home Delivered Meal Program, and Part D, Preventative Health, the allocation is based on the state's population, age 60 and up, as a proportion to other states and territories. For Title III, Part E, Caregiver Services, the allocation is based on the population age 70 and up as a proportion to other states and territories. For NSIP grants, the Nutrition Supplemental Incentive Program, the allocation is based on the total number of eligible meals served in the prior year as a proportion to other states, territories, as well as tribal grantees. For Title VII Ombudsman and Elder Abuse Prevention grants, the allocation is based on the state's population age 60 and up as a proportion to other states and territories. By statute, there's also a minimum percentage of the total allocation that a state must receive for Title III and Title VII grants. For Title III and Title VII, the minimum allocations are 0.5% for states, 0.25% for Guam and the Virgin Islands, and 0.16% for American Samoa and Northern Mariana Islands. And federal fiscal year 2021, 14 states and territories received the minimum allocation for Part B and C1, and 15 states and territories received the minimum allocations for Part C2, D, and E. For the Title VII Ombudsman grants, in 2021, 15 states and territories received the minimum allocation, and for the Title VII Elder Abuse Prevention grants, in 2021, 17 states and territories received this minimum allocation. There's also a hold harmless clause. It's a minimum allocation a state must receive as it relates to a single year. Sometimes I've heard this referred to as a base year. For Title III Part B, Supportive Services, and Title III Part C1, the Congregate Meal Program, the base year is year 2019. And for the Title VII program, the base year is the year 2000. There's no hold harmless provision for Title III C2, the Home Delivered Meal Program, Part D, Preventative Health, or Part E, Caregiver Services. For Title III Supportive Services and the Congregate Meal Program, for the hold harmless, if the appropriation levels are less than or equal to 2019, for states only, the allocation incrementally steps down by 0.25% from the 2019 base year through 2029. However, if the appropriation levels are greater than they were in 2019, which it was in 2021, the award amounts are determined a little differently by first applying the 2019 base amounts and then allocating the remaining of funding based on a proportion of the population age 60 and up. For 2021, since the appropriation levels were greater than they were in 2019, no state was under the hold harmless minimum. For the Title VII Ombudsman program, the allocation will not be less than the amount allocated in fiscal year 2000. For the Ombudsman program, no state was a hold harmless allocation state for the Title VII Ombudsman grant due to the increases in the appropriation from the year 2000. However, for the Title VII Elder Abuse Prevention grants in federal fiscal year 21, 33 states and territories have a hold harmless allocation levels. So next slide, please. We'll move on to the intrastate funding formula. So the intrastate funding formula is how a state allocates funds to the planning and service areas within your state. The SUA, the state, must distribute the Title III, Part B, C1, C2, E, and E per the intrastate funding formula that is approved by the Assistant Secretary for Aging in the state plan. Title III-D funding may be distributed per a different formula that is approved by the Assistant Secretary for Aging in the state plan. And for the NSIP program, your Nutrition Supplemental Incentive Program grant, those funds must be allocated per state policy. Title VII funds are not subject to the intrastate funding formula. The Assistant Secretary for Aging advance approval is required for any changes to your state's intrastate funding formula. Next slide, please. For Title III-D, if a state elects to use a different formula for Title III-D, the formula should give priority to areas of the state which are medically underserved and in which there are large numbers of individuals who have the greatest economic and social need for services. Rhonda will be discussing further medically underserved areas later in today's presentation. Next slide, please. Distribution of funding. So after any state planned and/or long-term care ombudsman funding has been allocated, the remaining funds for Title III must be distributed via the Intrastate funding formula to the planning and service areas. Funds may not be held or expended at the state level. So now I'll be handing the presentation back over to Rhonda.
Hey, thank you, Alice. So fortunately, I am connected by phone because I have now lost my internet connection. And fortunately, I have a hard copy of the slides. So I am looking at the slide that says Older Americans Act on it. And this slide is showing you actually language that comes right out of the Older Americans Act related to the IFF. And the reason we wanted to show this to you is we wanted to show you that the requirements that we're going to talk about today come right out of, the Older Americans Act. Oh, I can now see my internet connection has been restored, thank goodness. So just quickly, a couple things I want to touch on that you'll see here on this slide. You note that it mentions consultation with area agencies. You'll see the phrase best available data being required in there, requirement to publish for review and comment, taking into account certain things such as geographical distribution of older individuals. And if you note in the bottom paragraph there, it talks about taking into account older individuals with greatest economic need and individuals with greatest social need. These phrases are defined in the Older Americans Act. You can actually find them, the definitions, in Section 102. The term greatest economic need is defined as the need resulting from an income level at or below the poverty line. And the term greatest social need means the need caused by non-economic factors, which include physical and mental disabilities, language barriers, and cultural, social, or geographical isolation, including isolation caused by racial or ethnic status, that restricts the ability of an individual to perform normal daily tasks or threatens the capacity of the individual to live independently. And we can go to the next slide. And I'm not sure if you did, and perhaps you did, but I'm not seeing it. Okay, so this next slide is showing additional requirements of the Older Americans Act related to the IFF. This section here gets at the requirements that you have to comply with for the public notice that you have to put out when you're changing your IFF. So there's a requirement of a descriptive statement, a numerical statement, a listing of the data used for each planning and service area, and a demonstration of the allocation of funds. Next slide. So as I just mentioned, what I just rattled off quickly in that list from the section of the Older Americans Act, those are all the items we're going to cover now in the rest of the presentation. So we're going to look at the requirement for the descriptive statement, we'll look at the data source requirements, factors and weights, requirements to allocate by PSA, and the required numerical statement. Next slide. So first, let's look at the descriptive statement. So it needs to include any assumptions that you've made with respect to your establishment of your formula and the goals that you're trying to achieve with your formula. You also should include a discussion of how you are applying the definitions of greatest social and economic need in your formula. You should be disclosing in your formula, if prior to the distribution under the IFF to the AAAs, if any funds are deducted from Title III funds for state plan administration and or long-term care ombudsman allocations. Now, you don't need to include exact dollar figures here. You can just say that you have deducted first funds for state plan administration and long-term care ombudsman allocations. And it's best if you don't put a hard dollar figure in there, because if you put a dollar figure in there, then you'll later, if you want to change it, you're going to have to actually go through an amendment of the IFF. You also need to include a statement explaining how NFIP funds are distributed. Next slide. Now, you are allowed to include, as I think Alice touched on earlier, a separate formula for Part D. So you would include, if you're going to do this, you would include a separate descriptive statement about your Title III Part D formula and how it's targeting medically underserved areas and areas in which there are a large number of older individuals who have the greatest economic and social need for such services. If you elect to use a separate formula for Part D, a separate descriptive and numerical statement is required. Next slide. Now, there is a tool available that you could use if you choose to do so in order to locate medically underserved areas in your state. It's a tool that was developed by the Health Resources and Services Administration. It's another HHS agency, which we often refer to as HRSA. So HRSA defines medically underserved areas as geographic areas that have a shortage of primary health care services. And you'll see this link here to that section of HRSA's website where you can find this information. The actual medically underserved area tool that you can use to find the areas is also listed here on this slide. You can see the link there. And the tool allows you to locate medically underserved areas at state, county, and census tract levels. Next slide. Okay, now we're going to take a look at data sources. So this is the list of the data that you're using in your IFF by planning and service area. You need to include the source of the data that you're using to run the IFF. And as we saw earlier in that section of the Older Americans Act, you're required to use the best available data. So that could be most current U.S. Census data, which the U.S. Census data is that decennial data that comes out every 10 years. You can use more recent U.S. Census estimates from the American Community Survey. You also could use more recent data of equivalent quality that's available in your state. That could be considered, and I recommend that if you want to use a different data source, please consult with your RA just to make sure that that's going to be an acceptable source of data. And I want to provide a warning. If you use only the decennial U.S. Census data, that's the data that comes out every 10 years, if you do that, that may cause you to end up with significant demographic changes in that 10th year as you're updating to the new census data, and that could lead to substantial changes in funding allocations among the planning and service areas. And we did, as this year was a year when there was new census data coming out, because we had the 2020 census data, we did actually see some states experience that problem. So again, that's just something to keep in mind as you're considering what data to use in your formula. Next slide. Okay, so I want to talk a little bit about the American Community Survey. Here's the link there that you can see where you can find that on the census.gov website. The American Community Survey is conducted each year by the Census Bureau. Data is available in 1-year estimates and 5-year estimates. There used to be 3-year estimates that were available, but the Census Bureau isn't doing the 3-year estimates any longer. Next slide. Now let's do a comparison of the two different ACS surveys that are available. The 1-year estimate only includes data for populated areas of 65,000 or greater. It also has the smallest sample size, and as a result, it's less reliable. The positive thing about it is it's got the most current data. The 5-year estimate, on the other hand, includes data for all areas, so you're not going to be missing any data, and in particular, rural areas that could be excluded from the 1-year estimate. It's the largest sample size, so it's more reliable. It does have less current data than the 1-year estimate, but only because it's including, in addition to that 1 year, the 4 previous years. So my recommendation to you is to use the 5-year estimate if you're going to go with the American Community Survey data. Next slide.
And Rhonda, this is Alice.
Sure.
If I can interrupt you for just a minute.
Sure.
We are receiving reports that participants that are not on the HHS network are not able to get into the webinar, and so they're all calling in. I wanted to let everyone know that is on the call. We are recording this presentation, and it will be posted on our website. And we apologize for any technical difficulties you may be on. If you have received the presentation, which we just forwarded out to the regional administrators, we are on slide 22 right now. Thanks, Rhonda.
Oh, gosh. Okay. Thank you, Alice. So I guess we have a lot of people who are just listening to us on the phone. Is that what's happening? Okay.
Yes, that's correct.
Okay. Oh, gosh. Okay. Sorry about that, everybody. Right, I'm going to go on to slide, the slide that says ACS survey subjects at the top. So just want to touch upon that here we have this link, a link on the slide that shows how you can get to this part of the census.gov website that shows you all of the subjects that are included in the American Community Survey. So the subjects include such areas as social, housing, economic and demographic characteristics, and it includes information that's available by disability status. So there's cognitive information, ambulatory, ability to self-care, and independent living difficulties. So it's an interesting place for you to look to see if it might have some data elements that you would find interesting to include in your IFF. Going on to the next slide. Okay, so next we're going to touch upon the factors and weights. So again, your formula needs to include a factor, and you have to include a descriptive statement of each factor that you're including in your formula. For example, one factor could be people 65 and older with limited English proficiency. You also need to assign a weight to that factor. So for example, you could decide that's going to have a weight of 15%. So 15% of the funds are going to be allocated based on that factor. Keep in mind that the factors you select should help to achieve the Older Americans Act requirement that preference be given to older individuals with greatest economic needs, older individuals with the greatest social needs, with particular attention being given to low-income older individuals, including low-income minority older individuals with limited English proficiency, and older individuals residing in rural areas. Next slide. So we want to take equity considerations into account as you're thinking about developing your formula or making changes to your formula. So think about whether the factors that you're looking at or that you have in your formula currently are helping to distribute funds as contemplated by the Older Americans Act. Also keep in mind that even if the other intrastate funding formula requirements are being met by your state plan IFF, a state still may be asked to update the factors. For example, take this example as a hypothetical. Say 50% of a state's funds are going out as a base under the IFF, and then 70% of the remainder of those funds are going out just based on the population 60 and older in your state. That's not a formula that is really achieving what is supposed to be happening under the Older Americans Act. You're not able to use that formula to target the funds where the Older Americans Act intends it to go. So if you had a formula like that, even though your formula otherwise is meeting the requirements of the Older Americans Act, ACL may ask you to update your factors. Other things to think about, if you think about age, or if you're using age as a sole indicator of frailty or a need for assistance, you might just want to think about that and whether age is good to use as the sole indicator for that characteristic. For example, just keep in mind minority populations tend not to have lifespans that are as long as Caucasians do in the United States. So that's something to keep in mind. Also, living alone as a sole indicator of social isolation is something to think about. It could be very possible that older adults who live alone may be quite involved in their communities, may have very active lives. And so just the fact that somebody lives alone doesn't necessarily mean that they are socially isolated. And of course, when you're thinking about your factors, if you're thinking about modifying or updating your factors, of course, it's obvious you need to make sure that you're selecting data that is available for your planning and service areas. And we certainly understand at ACL that you're going to be limited in what you can do with your formula by the data that is available to you. I'm going to go to the next slide now, and I think I'm turning things back over to Alice.
you, Rhonda. And for those of you following along, we're on slide 25, allocation by planning and service area. So a state should demonstrate how the funds are allocated per the funding formula to each planning and service area in the state. These allocations should be by planning and service area, segmented by part of the Title III grant. An example would be to have a chart that has the PSAs listed with an estimated allocation of funding by Title III program part. Next slide, which is number 26. Planning and service areas. The IFF should allocate funds by planning and service area. An area agency on aging's region may include more than one planning and service area. The Older Americans Act defines that the state designates the planning and service area. Next slide, slide 27. So next we'll be talking about the numerical and mathematical statement. It's required for parts B, C, D, and E, and this would allow a member of the general public to review the formula and to run the formula themselves to see the results of different scenarios. A separate numerical mathematical statement may be provided for Title III Part D to target the medically underserved and for which there are a large number of older individuals who have greatest economic need for such services. If a separate formula is used for Title III Part D, a separate descriptive and numerical mathematical statement is required. We at ACL have seen a number of intrastate funding formulas where the numerical mathematical formulas are either lacking, partial, or even not included. We have seen where portions of the IFF were not included in the numerical formula, like annual caps on the reduction in service allocations, and not including how to proceed in a formula when minimum allocations are used, and where the reductions would come from when others are bumped up. The numerical formula is very important so that others are able to understand and run the formula themselves. Let's move to slide 28, which is the numerical and mathematical statement continued. So you may include in your numerical statement on how state funds, Title VII, Title IIIB Ombudsman, and/or INSIP funds are distributed. However, that is not required. Prior approval is not required for the amendments to the above funding sources. However, informational amendments should be submitted if there are any changes. Next slide. On minimum allocation. So states may use a minimum allocation of funds in their IFF to ensure viable funding across the entire state. So examples, and this is not an all-inclusive list, include a fixed dollar amount of minimum allocations by part. An example would be that every PSA receives $50,000 in Title III Part B, and then the remaining allocation is run through the formula. Another example would be a minimum percentage of the total state allocation by part. An example would be that every PSA receives a minimum of 5% of the total state allocation by part. Another example is an allocation received must at least equal the allocation received in a specified year. So an example would be that every PSA receive at least what they received in federal fiscal year 2015. And then the last example I have here is that no PSA may receive more than a specified percentage or dollar figure reduction in any given year from the prior year. An example would be that no PSA will have a reduction of more than 5% from their prior year service allocation. So all of these examples need to be included in the formula if the state is choosing to include them. Additionally, if there are increases, the formula needs to show how other PSAs would be decreased to make up for any increases. So I'll be handing the presentation back to Rhonda.
Thank you, Alice, and we are now on slide 30. So now we're going to talk about the process for amending an IFF. You may recall earlier in the presentation, I was referring to the actual sections of the Older Americans Act that actually provide for a required process. So there is a specific process that is mandated by the act that has to be followed. So amendments need to be approved in advance by the Assistant Secretary for Aging. If you are amending your formula at the same time that you are submitting a state plan, you can do it simultaneously. If your amendment doesn't coincide with a new state plan submittal, you can amend your IFF in the middle of a state plan period. You would just need to submit that as an amendment to the state plan for approval. Your proposed IFF statement and formula needs to be published for review and comment by older people, by appropriate agencies and organizations. Those would be, your aging network stakeholders, as well as the general public. And your AAAs must be consulted and offered an opportunity for input in your amendment of your IFF. Now, again, your public hearing, if you're doing this at the same time that you're amending your state plan, or that you're doing a new state plan, you can have your public hearing at the same time, but please keep in mind, your hearing notice must clearly indicate that you are amending the IFF. It's not enough to have a notice for your new state plan that you're putting out there for public input and not also note for the public that you are amending the IFF. So that has to be noted in the public notice. These requirements apply anytime the formula is amended, and your submission to ACL should show that you have complied with all of these requirements. Now, something to think about regarding timing, especially for those state units on aging that have plans due in July 2022, you may want to start looking at your IFF now to see if there are any changes that you need to make to it in order to update it to come into compliance with the Older Americans Act requirements. We can go on to the next slide. It's 31. And now I'm going to talk a bit again about the information that needs to be included in whatever you're publishing for review and comment. So you need to include a descriptive statement again of what you are including as your assumptions and goals of your formula, as well as how you are applying the terms of greatest economic and social need in your formula. A numerical statement of the actual funding formula has to be used. Now again, you need to include the numerical statement of every step of your formula. If your formula has 5 or 6 steps to it, you need to make sure you've got the numerical statement for every step reflected in the formula. You need to make sure you're including a listing of the population, economic, and social data that you're using for each planning area in the state, and you need to include a demonstration of the allocation of the funds pursuant to this proposed amended formula as it applies to each planning and service area in the state. And keep in mind, as you're revising your formulas or updating your formulas, a member of the public should be able to take that IFF document and read it and understand exactly how your formula works in your state, and should be able to understand how the numbers run through that formula. The whole idea behind this is being transparent, and we just want to make sure everything is clear. We can go on to the next slide, which is 32. Now, I do want to touch upon the requirements applicable to single planning and service area states and territories. While these states and territories do not have to have intrastate funding formulas, there are requirements that apply. Since some folks are not seeing this slide, I'm going to read off this list of the single planning and service area states and territories. So we have Alaska, American Samoa, Delaware, Guam, the Northern Mariana Islands, Nevada, New Hampshire, North Dakota, Rhode Island, South Dakota, Washington, D.C., and Wyoming. We can go on to the next slide, which is 33. So the requirements that apply to the single planning and service area states and territories are pretty simple. You need to include a descriptive statement as to how you determine the geographical distribution of your Title III funding in the state, and you need to explain how the state is targeting the funding to reach individuals with greatest economic and social need, with particular attention to low-income minority older adults. Now, a numerical statement of how you're distributing the funds is not required for single PSA states. Next slide, which is 34. This slide is just explaining the state plan guidance trainings. So we are noting that the first training, which was the state plan guidance overview, took place on September 27th. There's a link on this slide for where you can find that training. The next training is going to take place on November 15th at 2 o'clock Eastern Time. That is a training on developing performance measures with clear outcomes. And as Alice mentioned, I believe at the beginning of the training, this training, the slides as well as the recording should be available in about a week at the same link that you see there for the training for the September 27th overview. I think we can go to the next slide. That concludes our presentation, and I think we have some time for some questions.
Rhonda, this is Alice. So we will be posting, like you said, these slides as well as the recording on our website. We will be sending a link to your regional administrators in the coming week or weeks, and that can get out to you. Rhonda, the only way that we can take questions right now is if we unmute everyone. Is that okay?
Sure.
Let's go ahead. Okay, and Louise actually asked that we want to mention that long-term care ombudsmen don't have to use the interstate funding formula for distribution of funds to local ombudsman entities. So we'll mention that as well.
Any questions? We apologize that this was a little difficult for everyone today for our technical issue there.
And I don't think that they're unmuted quite yet. So.
Oh, okay.
You can also forward any questions you have to your regional administrators, who can forward them on to Rhonda and I, and we can get back to you on any individual questions you may have.
Yeah, it appears that we're having trouble unmuting folks, unfortunately. Well, Alice, I guess if we're not able to unmute folks, we'll just have to ask that folks follow up by emailing questions to their RAs, and we will respond to those questions.
That sounds great.
Yeah, so sorry about the technical difficulties we've had today, everybody. So I guess we'll, because since we can't unmute and where people aren't able to submit questions through the chat, I guess, Alice, we'll draw this training to a close.
We'll draw this training to a close, and thank you to everyone who's joined us today. Again, this training was recorded, and the slides will be posted on our website shortly. We'll be sending that information to your RAs, who will get that information out to you as soon as that is posted. And in the meantime, if you have any questions, you can forward those to your regional administrators. We'll get them to the right people to answer your questions. But again, thank you everyone for your time today and for joining us on this call. That completes today's training. Thank you.